Hello, guys around Canada. I'm glad to be here this morning and happy to share my own experience and talk about yoga. I've got a presentation I'm going to bring up, which will just help to take us through this. So just give me a second here to bring this up, and I'm just going to make it large. So hopefully you can see that, and I'm going to move that screen. There we go. All right. So yeah, I was reached out, or Rochelle reached out to me to actually share some information based on the program that we did here in Kamloops. So I'm going to talk a bit about that and also a bit about myself and my own experience. So happy to be here. I am a prostate cancer patient. I had prostate cancer. I was first diagnosed 4 years ago when I was 54. And I have an older brother who had prostate cancer around the same time. I also had a grandfather on my maternal side that had prostate cancer. I also have uncles on my maternal side, but none of them have had prostate cancer, so it must have skipped a generation. I have two brothers as well, two other brothers that have not had prostate cancer. So there is a propensity in the family. I also had a mother who had breast cancer. So just to give you a sense of that. I am a registered yoga teacher, or registered yoga teacher, yes, 500 hours, just in terms of my training. I'm also a certified coach, and I also have a master's degree in training. I also teach meditation and mindfulness, and I've had about 30 plus years of experience in meditation. I recently authored a book called The Dance of Dynamic Peace. It's more about meditation. It is not about prostate cancer, but more about how to create a greater sense of peace and calm in your life in dealing with anxiety and stress. Father to 2 girls and grandfather to 4, and I'm assuming that others that are on the call are also fathers and grandfathers. My own prostate cancer journey, as I said, began 4 years ago. Should be 2016, sorry, not 2014. I actually saw my family doctor in January, had a prostate exam, also had a PSA score taken, and evidently it was fine at that point. And then in June, I was experiencing some symptoms which I associated with prostatitis. I had had prostatitis before, so an inflammation of the prostate. So I was between doctors at the time, so I went to a drop-in clinic. And the doctor who was there did a digital exam and found a lump on my prostate, or a growth. In August, I had a biopsy. And with my biopsy, half of the prostate was fine. The other half of the prostate, there was Gleason 6 and 2 spots that were Gleason 7. So out of the 12 samples that they took, 6 had some problem, 2 were at Gleason 7. And then I was given some, actually, I got the diagnosis in September, and my urologist gave me options. One was to monitor it, the other was to have surgery, and the other one was to use the radioactive pellets. And it was my choice. I elected to have a radical prostatectomy and removed, which was done in November. After that, I did not require ADT or radiation, and my current PSA levels are less than 0.008 and have been so consistently at that level. So I feel very fortunate in terms of my own diagnosis and treatment. It appears that it wasn't an aggressive form of prostate cancer. So as I said, I feel very fortunate in having that. Some of the challenges that I experienced, and some of these you already know about, some of them you may not know about, and I just thought I would share some of these things. After my surgery, while I still had the catheter in, I had terrible bladder spasms, and I spoke to my urologist about it. He told me that he could give me medication, but that would create constipation, and which is going to be worse, the spasms or the constipation? I think I would have taken the constipation. versus the spasms. I had that right for the full 10 days before the catheter was removed. And on the 10th day, I insisted on having the catheter removed. I couldn't take it any longer. Something else that I experienced, and I don't know if any others have, there is a higher propensity for this within men who have had prostate cancer, was Peyronie's disease. You may know about it, you may not. It is a hardening of the tissue within the penis itself. And it can be sore, at least initially. It also will lead to, or can lead to, curvature of the penis during erection, and can also decrease sensitivity within the penis. I developed that afterwards. Not sure if it was a result of the bladder spasms or something else that occurred. And as a result, I have about between 35 to a 40% curvature of the penis. So that can be problems during intercourse. The other thing I wanted to talk about was around bladder control, Kegel versus pelvic floor exercises. My urologist talked to me about Kegel exercises. And so a Kegel, if you are familiar with it, and you probably all have done it, is practice stopping the flow of urine. And I was advised to do that before surgery and also after surgery, and that would help with incontinence. What I found is they did help, but they didn't help to the extent that exercises with pelvic floor did. And I actually had a fellow yoga teacher who had studied pelvic floor exercises working with women who have prolapsed uterus as a result of childbirth. And so I did a lot of work around pelvic floor exercises. And just to give you a sense of where the difference is, if you, for a moment, just feel as if you are trying to stop the flow of urine, you know that it's an engagement more within the penis. The pelvic floor is actually between the base of the penis and the anus, and it's more of an engagement in that area. And so it really is a prostate point, and you are engaging that to actually strengthen the muscles that have been affected as a result of prostate removal. So I learned about that, and I also incorporated that into my yoga classes. Certainly, I was fortunate again. I did not have erectile dysfunction. I think about 3 weeks after surgery was my first sort of experience around having my first sort of an erection. And since then, it hasn't been an issue for me. I did take Cialis. The doctor had recommended it because it helped. I took it probably about half of the 5 milligrams that he gave me each day for, I think, about, it may have been 3 months, which really, I don't know if that helped, but it certainly wasn't an issue for me. One of the things that I think doesn't get talked enough about or mentioned is the loss, after having surgery, the removal of the prostate. While you may be able to have an erection, is the loss of the sensation that's as a result of loss of ejaculation. And I think, you know, there's a grieving process that occurs, you know, for women who have gone through radical mastectomies. You know, there's a bit of a grieving process, the loss, the change that happens to you physically. And I think that that's something that for men, they need to be aware of and consider as a result of the changes within the body if you have surgery. The other thing that I wasn't aware of, that I was made aware of, is that men who have had prostate cancer do have a slightly elevated risk of cardiovascular disease. And the urologist never told me about that. Nobody did. So there was a number of things with my urologist that I didn't get information in. I asked a lot of questions. My information that I did receive was really do Kegel exercises and hope for the best. And so I really wanted to do something a bit more. So I was asked by someone from the city of Kamloops who was bringing this yoga program to Kamloops as a pilot. So the program is called True North, and I think a number of you may have heard about it. It's on the cancer national website. I think that they have information about it. But at the time, this was a few years ago, the University of Calgary asked the city of Kamloops to do a pilot project. And I believe at the time we were the only ones in Kamloops, or actually in British Columbia, that were doing it. So we piloted it here and also provided feedback to True North. The program objectives were to improve mobility for patients of prostate cancer, to improve the stability, to improve overall flexibility, and also overall energy level, reduce the pain and also the side effects of cancer and its treatment. There were other benefits as well that came out of that program, or the goal was to reduce anxiety, to help with depression, and also increase overall sense of well-being. So we brought the program to Kamloops, and it is a 12-week class program. It was in person, so at the time we weren't dealing with a COVID pandemic. It was based in gentle Hatha. Hatha really just means movement. So it was a gentle movement. Iyengar refers to alignment-based. So it's alignment-based movement, and also therapeutic yoga principles. There was a progression, so the poses got more challenging over the 12-week period. The program included some discussion of pelvic floor, but it really treated it more as Kegel exercises than pelvic floor. And so it also talked a bit about breath work, but not a lot. The class duration was 75 minutes. 60 minutes was yoga postures, and then 15 minutes for Q&A. And I found that the Q&A very important in the class. What I also found important was at the beginning of the class in sharing my own experience and just being open and talking about everything from incontinence to erectile dysfunction, and some of the challenges that were related to that. We did talk a little bit about some of the challenges that came along with ADT, so androgen deprivation therapy, in terms of weight loss, hot flashes, emotional swings that can be as a result of ADT. And then also a little bit about radiation, but I wasn't an expert in both those areas, so I actually relied more on the participants who were there and let them share their experience. And that helped to create a greater sense of community as well. The exercises, again, were focused to help to reduce the effects or side effects of incontinence. So how can we help to strengthen so that we don't have leakage? With myself, I wore a small pad or a light pad when I was working out. But what I think will also help me is I was actively doing yoga prior to my surgery. And then 6 weeks after, I went back to doing yoga again. So I think that really helped in terms of my own issues around incontinence. I generally do not wear anything now after 4 years in terms of working out. Although I haven't gone running, that may be an issue. And I also find, or at least I did find, that walking downhill for some reason would create more of an issue with incontinence for me than walking at any other time. So I don't know if that's others' experience as well in that. Other benefits that we really were trying to deal with was fatigue in terms of both ADT, radiation therapy, and also just recovering from surgery. I had some iron deficiency. I'm a 30-year vegetarian, and so I had some issues with iron. Another thing that we wanted to do was really around helping with balance and being able to have greater balance, and then also stress reduction. There were variations that were provided in the poses, so it depends on your level of skill and your ability. So we would do modifications, and so the program provided those modifications. And we certainly used props. So we would use straps, bolsters, which just is a big sort of thick pillow, blocks, which we would use in terms of helping for support, chairs. We'd also use the wall in terms of balance as well as we moved through that. This first slide here is taken right out of the True North program that we were given at the time. This is just the week 1. So you can see very first thing, you know, you're reclined on your back, knees are bent. We're doing some breath work, and we would probably do some pelvic floor work. Second exercise is really moving the arms overhead, which is really going to stretch the abdomen. If you've had surgery or radiation, you may have some scar tissue there. It can help with that. Seated shoulder rolls to help with tension, and also expand the breath, because when we get stressed, we tend to contract and hold our breath. You want to be able to drop the shoulders and be able to breathe more. And then it would move into what we call cat and cow, which is just on all fours, and you're moving between a rounded spine and an arched spine. And here's just another example of week 2. Again, we started with some breath work. We may do a full body stretch. Here you can see the reclined use of a strap where we're actually extending the leg, seated posture, and again, perhaps some cat and cow poses. So this gives you a sense of some of the poses that we were doing. This is not the full class for each of the days. This is just the first page of classes or of exercises that we would do in the class. After a while, we found that the program actually didn't flow that well with yoga principles, and so we revised the program. And I created new handouts, which included pelvic floor exercises. We wanted to ensure that this really was worked into the program to really help with incontinence. And then those handouts were available for people to take home as well. The benefits of the program, this was benefits that were actually stated by participants. And I should say, our program was never hundreds of men. It was at the most, I think we had 7 at any one time. And the least, I often, not often, but sometimes had a class for 1 person. It just depended on if people were traveling, if people were helping out with grandchildren, or if there was something else that was coming up. I also should mention that the city of Kamloops had a weight training program, and there was more participation of men in the weight training program than the yoga. And I think that was because weight training is typically, you know, something that men would do normally, and that the view that yoga is for men was often viewed, well, this is more for women to actually do that, which isn't the case. Yoga was first of all designed by men, and it was mostly men that did yoga. The advantage that the yoga provides is you're still going to get the strength training, but what you're also going to get is the mobility, the movement, the increased movement within the body. You're going to get also the stretching or the opening, the helping to remove in terms of scar tissue, recovery from surgery. It also is going to help you with your balance, which weight training really isn't going to do. So there was a lot of added advantages to doing a yoga program. And as I said, here are the things that participants found: an increased sense of confidence. I remember a gentleman coming up to me after class and saying, you know what, Wayne, I didn't have any leakage at all this class. It was really good. And, you know, he was just really proud of himself, and I was proud of him as well, just from doing the exercises and the benefits. Greater mobility really helped with their golf game. I don't know how many times I heard that. This really helped with my golf game. So certainly incontinence improved. There was an increased social connection. They would go for coffee afterwards. There was a connection, and they actually were able to talk with each other a bit more because I made the classes very open, and we really kind of explored anything that they really wanted to talk about. there was greater self-acceptance of the lifestyle changes. So, you know, if you have surgery or you have therapy, either ADT or radiation, you know, you get those things and then you kind of go home and you're kind of on your own and you're kind of dealing with your own stuff and you kind of keep it to yourself. And I think because of the social interaction and because of groups like this group, I think there's a greater acceptance of the lifestyle changes, the issue with incontinence, the idea of actually wearing a pad. My urologist never showed me how to even wear a pad, use a pad. You know, it was really my GP that for the first time taking out the catheter that really helped me just even to think about it. So those types of lifestyle changes that you probably deal with on your own, that would be helpful to have other men to talk to about it. And then, as I said, just an openness to share with others in the same situation. So I'm going to stop there. I just wanted to share that information, talk a bit about the program, my own experience and challenges. I'm going to stop sharing and we'll come back to the Q&A.